Hi everyone! In today's video I'm going to explain what SIBO is, the symptoms of this condition and why it tends to recur even after antibiotic treatment. Common symptoms of SIBO include bloating, gas, diarrhea, constipation, abdominal pain, heartburn and nutrient deficiencies. My name is Joanna Marciszewska. I am a clinical dietitian. I run an online clinic where I help patients with SIBO among other conditions. So what is SIBO? SIBO stands for Small Intestinal Bacterial Overgrowth. It's a condition where there is an excessive growth of bacteria in the small intestine. Now it's important to know that bacteria do naturally occur in the small intestine, but in much smaller numbers compared to the large intestine. The goal of SIBO treatment isn't to completely eliminate these bacteria, but rather to regulate their numbers. There are several types of SIBO: hydrogen SIBO, which often causes diarrhea, methane SIBO, also known as EMO, which typically results in constipation, and a mixed type which involves an overgrowth of both hydrogen-producing and methane-producing bacteria. There's also sulfur SIBO, which in many countries is not yet diagnosed, but in some countries tests are now available. To diagnose SIBO, breath tests that measure hydrogen and methane levels are commonly used. Soon I will be adding a video on how these tests work and how to prepare for them, so make sure to subscribe to stay updated. It's better to opt for the hydrogen-methane test rather than just the hydrogen test, as the latter can miss cases where methane-producing bacteria are prevalent. If the test confirms SIBO, a gastroenterologist might prescribe antibiotics. These symptoms can be quite general, so it's essential to get tested to confirm SIBO. Interestingly, over 80% of people with IBS also have SIBO. This is because untreated IBS can lead to conditions favorable for bacteria overgrowth. Now let's talk about why SIBO tends to recur. Studies show that about 44% of people who undergo SIBO treatment with antibiotics experience a recurrence within 9 months. This happens because SIBO usually has an underlying cause. If we don't address the root cause, the conditions that favor bacteria overgrowth will persist. Our bodies have several mechanisms to prevent bacterial overgrowth in the small intestine. One of these is the migrating motor complex, MMC, which helps clear our residual food particles and bacteria between meals. To allow the MMC to function properly, it's important to have gaps of 2 to 3 hours between meals. Other protective mechanisms include digestive enzymes, which have antibacterial properties. Problems like low stomach acid, insufficient pancreatic enzymes, or inadequate bile production can create conditions conducive to SIBO. Additionally, slowed intestinal motility can also contribute to bacterial overgrowth. To prevent SIBO from coming back, we need to address these underlying issues. I've covered this in detail in a webinar and the link is in the description. Common causes of SIBO include medications like proton pump inhibitors, prolonged antibiotic use, but also untreated hypothyroidism, poorly managed diabetes, and insulin resistance. Lifestyle factors such as rushed eating, lack of physical activity, and high stress levels can also play a role. Antibiotic therapy is often necessary for treating SIBO, and I usually recommend combining it with Saccharomyces boulardii, a probiotic that has been shown to enhance the effectiveness of antibiotics like xifaxan and metronidazole. Diet is crucial as well. We need to not only reduce bacterial overgrowth in the small intestine, but also strengthen the gut flora in the large intestine. Post-antibiotic treatment, I often recommend a low FODMAP diet to reduce the risk of recurrence and address any concurrent IBS. You can find a video about this diet on my channel, which I am linking here and in the description. There are also various supplements and lifestyle changes that can help. Let me know in the comments if you have any questions or if there are other topics that you'd like me to cover. Please don't forget to subscribe my channel, give this video a thumbs up, and I will see you in the next video.